Hey YouTubers, it's Regina. It's Friday the 12th and I am just back from my appointment with my lap band surgeon. And yes, I look a hot mess. I know. I get my hair done on Sunday. Believe me, I know. But anyway, so before I tell you about my lap band appointment, let me tell you about yesterday. So I woke up and knew that I was taking my drains out. Yes, I was taking my drains out. My girlfriend was working. She wasn't going to get off work till 7 o'clock at night, and I was just like, no, I want them out this morning because I can shower 24 hours after the drains come out. So I wanted to shower before this morning's appointment. So I woke up, went to the refrigerator, got ice, put ice on the area for like 15-20 minutes, got it a little numb. This is the part of the video where I say if you're squeamish, don't watch, because I'm going to show you the drains and what part of the drain is actually inside of your incision. And then I'll tell you what it was like to take it out. Okay, squeamish, turn away. This is what is inside of you. I'll just show one. They're exactly the same. And if you can see, it's perforated. Has all those little holes to suck the fluid out. And it works on like a suction type thing. The bulb itself stays compressed at all times. This stays compressed, and that suction that you create inside of this makes this part suck the fluid out of the surgical area. Now, let me show you on my body, because this is a good, I would say that's almost 9 inches, don't you think? 9-10 inches? Let me pull back so you can see. That whole white part was inside the body. The clear part is outside of the body. Okay? Let me show you where I was feeling it as I was pulling. I felt it all the way back here. So they were inserted. My gosh, can you guys even see? They were inserted here in the pubic area, and I felt them all the way back here. As I was pulling, I could feel them releasing, because they were in my body for almost 16 days, 15 days. And actually somebody commented on Facebook that they thought they would have been out. Actually, having your drains out quickly is not always the best thing, because it's doing a job. It's pulling all that fluid out of the surgical site so that you have less swelling, less chance of infection and things like that. Dr. Katzen's paperwork says that you can have your drains from 10 to 21 days. So people that get them out, 3 or 4 days after may not be a great thing. Mine were still draining about 10 to 15 mLs in a 24-hour period. So that's a teaspoon to 2 teaspoons to almost a whole tablespoon every 24 hours. And he said that they could come out when they were less than 30 mLs in a 24-hour period for several days. So 30 mLs would be 2 tablespoons a day. And they had been much less than that for like the past 4 or 5 days. I left them in longer because if I have an issue, Dr. Katzen's in California. Who am I going to see locally? Do I see my PCP? Do I hook up with somebody here? It wasn't worth it to me. I let them stay in. I was on the antibiotic the whole time. So that's another thing. You have to be on an antibiotic as long as you have your drains. What else? Okay, so I would never want to do that to myself again, take out my own drains. I mean, it was totally doable, but it was a very weird sensation. Very, very weird. A little painful for maybe like 2-3 minutes. Because as I started to say, it's in your body, and it's been in your body for 15, 16 days. It wants to become a part of your body. So it starts to adhere a little bit to the tissue. So you feel that kind of pulling, tearing sensation as you're pulling them out. So enough about that. This morning's appointment, I talked to the MA, the medical assistant. You know, she weighs me, gets my blood pressure and everything. And she's like, so what's been going on? You look great. And I was like, oh, I feel great. You know, I had my abdominoplasty, blah, blah. She was like, oh my God, that's right. You were talking about that. So anyway, Dr. Smalls comes in, my baby love. You know, I talk about how much I love my practice so much. But he comes in and he's like, hi, how are you? I was like, well, I'm kind of throwing you a curveball this morning, but I brought pictures to help you out. So we talked about my plastic surgery. He looked at my incisions and everything, and I was telling him about taking the drains out, and he was like, oh, I would have taken them out for you. And I was like, well, I wanted to take a shower today. Really, really wanted a shower before coming here today. And so I was telling him about the surgery and showing him the pictures, and he feels like he'll have absolutely no problem finding the port. He thought, just looking at the surgical photographs, that Dr. Katzen did a great job, which I agree. He thinks my results look amazing, and he refused to do a fill. I don't have an appetite. I think I may have talked about this previously. I don't really have an appetite, and I have to get 100 grams of protein and at least 1,000 cc's, 1,000 milligrams of vitamin C a day for healing. So he's not wanting me to have a fill. He wants me to continue to try and get as much nutrition as I can. And he was saying that it's not just the amount of tissue, skin that was taken off, but it's the fact that your whole entire abdominal cavity is exposed and surgically altered, and that's a lot of surface area that has to heal. So no fill for me. I'm to go back on December 23rd, and he's predicting that I'll be down another 10 pounds. I was sharing with him that I was a little bit disappointed that Dr. Katzen didn't do any lipo, and I was surprised he didn't do any lipo. And he's like, Dr. Katzen's like, you didn't need it. I resected that area and everything looks great. Well, this is what I was saying, that I look spongy. I don't know if I can even show you guys. I'll try to bend the camera down so you guys can see what I'm talking about. Oh, I don't know if this is going to work. But, like through here, oh, I have on my Spanx. But through here, I still feel really spongy, and I'm like, he could have lipoed the flanks, you know? And Dr. Smalls thinks that that's all still just swollen from surgery, and thinks that I probably will not need lipo in that area. He was like, that's still really swollen because he entered that area, he resected skin and tissue from that area. The body's reaction is going to be an inflammatory reaction, which is to send fluid and white cells and everything to combat this injury, which is how the body feels and how the body reacts to surgery. It's an injury. So I felt so reassured, and even more confidence in Dr. Katzen, having my other baby love, you know, just tell me how great everything looks. My incisions are doing well, and how good a job he thinks he did, just based on seeing the photographs and also, you know, taking a look at my incisions. So that all went well. So I will see him on December 23rd, and we'll see what happens then. He's predicting 10 pounds. Fingers crossed, right? Because if I am down 10 pounds, I will be 5 pounds from his 2-year goal for me. And we all know my 2-year goal, 2-year anniversary is not till July, so that would be awesome. What else? Oh, the Spanx. I went online and I ordered some Spanx, but I went to just the local store here, and I got this one that's a panty that comes to under the breast. And then I got one that's to the thigh to under the breast. Well, let me tell you how I was trying it on, and the one with the thigh thing, the half thigh, how about I broke out into a damn sweat trying to get that thing on. I was pulling and tugging, and how do people do this every day? And this thing is not crotchless, so you know, you're trying to drink your 64 ounces of water, coffee, tea, and whatever else. I don't know how I'm gonna do it, people. Fingers crossed. That's really all I have to say. I will make a video, I guess, on Wednesday. Isn't it funny? I had lap band surgery on Wednesday. I had tummy tuck on Wednesday. So Wednesday was always my update day anyway. So I guess this is kind of getting me back on track. Weight wise, I'm 193.8. I had been 192.2. I'm kind of seeing that fluctuation. And even Dr. Smalls reiterated what Dr. Katzen said, which was, don't get on the scale. It's not accurate. You have fluid shifts. You have all this, you know, swelling and inflammation, and just don't get on the scale. I'm always on the scale. I'm on the scale every morning. I pee, I get on the scale. That's just what I do when I wake up. But I'm not letting the numbers affect me. Actually, my girlfriend told me today that I look like I was about 180. I was like, yeah, sweet. But she's like, you look so much thinner. I don't know what it is. You just look thinner. And I'm not going to say don't lose any more, but you look thinner. And I'm like, yay. So anyway, I'm just rambling now. Have a good weekend. Take good care. And as always, thanks for watching and being interested. If you have any questions or comments, of course, feel free to drop me a line.